Volkmann ischemic contracture is a deformity of the hand, fingers, and wrist caused by injury to the muscles of the forearm. Volkmann ischemic contracture occurs when there is a lack of blood flow, in other words, when there is ischemia to the forearm. This occurs when there is increased pressure due to compartment syndrome, or it may be due to arterial injury like the brachial artery injury, leading to less blood supply in the muscles of the forearm. Injury to the arm, including a crush, injury, or a fracture, can lead to swelling that presses on blood vessels and decreases the blood flow to the arm. A prolonged decrease in blood flow injures the nerves and muscles, causing them to become stiff. That is because of scarring. And not only stiffness, they become shortened. When the muscles shorten, it pulls on the joints at the end of the muscle, just as it would if it were normally contracted. But because it is stiff and does not relax like normal contraction and relaxation, the joints, they remain bent and stuck in that position. Now, what is that position? That is the contracture positioning. We'll take a look at the elbow, the forearm, wrist, thumb, MCP joints, and the IP joints. Elbow will be in flexion, forearm will be in pronation, wrist also in flexion, thumb will be in adduction, MCP joints will be in extension, and the IP joints will be in flexion. Now the classification of Volkmann ischemic contracture. There are two classifications. One is known as the Holden classification, which describes Volkmann ischemic contracture into levels 1 and 2. So level 1 and level 2. The other classification is Such classification, which describes or classifies it as mild, moderate, and severe. So level 1 is when the injury is proximal to the ischemia and the later contracture site. For example, in a brachial artery injury situation, the injury to the artery will be there and the ischemia and contracture will occur distally. So the injury is proximal. Level 2 is when the ischemia is directly under the injury. For example, because of pressure. In Such classification, mild means the resulting contracture is affecting 2 to 3 fingers only. Moderate means that all fingers are flexed, with the thumb flexed into the palm. The wrist is also in flexion, and there is partial loss of sensation in the hand. Severe means that all muscles that flex and extend the wrist and fingers are involved